all my dear nurses, welcome to a new video. In this video, I will discuss question. Okay, so please read this question, and every question discussion session, I used to say that please write down the important points. So here also, I would request all of you to write down the important points. Okay. Yes, the question is 42-year-old woman brought to the emergency unit with severe chest pain which is radiating to the left neck. Physician instructs nurse to start morphine aspirin protocol, that is MONA protocol. What is the top priority nursing care? Okay, so here the question is 42-year-old woman who is brought to the emergency department with chest pain, severe chest pain radiating to the left neck. What it could be? It could be either angina or myocardial infarction. Okay, here the physician instructs the nurse to start morphine aspirin protocol, that is MONA protocol. So what is the priority nursing care? Okay. So when you get any of question, you have to understand the meaning of the question first. Please don't read the option immediately. You should understand the questions here. A client with a chest pain or myocardial infarction or angina, and the choice of treatment already the doctor prescribed. It is start a MONA protocol. So what is MONA protocol? M stands for, M is indicating morphine, O is oxygen, N is nitrate, and A is aspirin. Clear? Yes. So here there is an order to start MONA protocol. So what is the first priority nursing care? Here the key point of the question is priority. That means the first intervention what we would do. Clear? So look at the option. First option says administer oxygen according to the physician. So what the physician says? MONA protocol. So what is the first in that? It is morphine. Second says administer aspirin according to the physician. Third, administer morphine according to the physician. And last is administer nitroglycerin according to the physician. So here there is a standing order to start MONA. So the first priority intervention is to start morphine. Clear? So we need to start morphine. Why? Because here there is a standing order to start MONA protocol. If this particular order is not present in this question, in case of myocardial infarction, the first choice of treatment is always oxygen. The first priority intervention, first priority management for a client with a myocardial infarction is oxygen. So please remember this. Now please understand what is myocardial infarction or what is the basic reason for developing chest pain. This is because of coronary artery spasm. Now look at this. Just look at here. This is coronary artery. Whereas the coronary artery is nourishing myocardium. So coronary artery is the branch of aorta where it carries oxygenated blood and it nourishes myocardium. Fine. So because of narrowing or because of constriction or because of any plaque in the coronary artery, the blood supply towards myocardium is reduced. Okay. So myocardial blood supply is reduced because of a thrombus in the coronary artery. Fine. So please remember, coronary artery carries oxygenated blood which nourishes myocardium. Clear? So because of deficiency of oxygenated blood supply towards myocardium, the myocardial cells will undergo hypoxia and it will undergo through an inflammatory changes, and as a result of that, anaerobic metabolism will happen, and because of anaerobic metabolism, some amount of lactic acid usually produces, and the lactic acid gets accumulated over the myocardial tissue. Myocardial tissues are responsible for contraction. So cardiac contraction gets affected because the myocardial cell damage, and when LDH like lactic acid accumulate in the myocardium, it causes severe pain. Fine. So ultimately this is because of deficiency of oxygenated blood to the myocardium. Manslayo. So basically this is because of deficiency of myocardial oxygenation. Clear? So since it is because of oxygenation deficiency, you need to start oxygen. But for this question, I have not selected oxygen first. I have selected morphine first. Why? Because there is a standing order to start MONA first. Clear? In case of myocardial infarction, the first management is always oxygen. But that is not applicable in this question because the question itself says that there is a standing order. So we have to follow that. Clear? I hope it is very clear to you. Thank you for watching. God bless you all.